Love marriage and genetic concerns. Love marriages in India are increasing year by year as most of young gen is clever and mature enough to know what's good for them. But love marriages in Indian context often creates silent anxiety inside the families. Parents worry about the heredity, the genetics, the inheritance, and unfamiliar medical terms like carrier state that may happen into their grandchildren. Let's examine this calmly and scientifically. Not all medical conditions behave the same way genetically. Some disorders follow what we medically call as autosomal recessive inheritance. In these situations, individuals may be completely healthy yet carry a silent gene variant in them. However, when the children are born, a child becomes affected only when both the parents, that is husband and wife, carry the same mutation. Some common examples of inheritance that we see in medical practice are connected with the neuromuscular system, blood, pancreas, and certain forms of albinism. You have a look at the table here on my video. Let's know more about albinism, as it's obvious to see it on the body, on the person. Importantly, being a carrier of albinism does not mean he is ill. The person looks normal in all aspects. Let's consider a practical real-world scenario. A young lady, let's call her Anamika. And Anamika wants to marry him, but the boy has got albinism. Her family fears serious health issues, worried about their grandchildren, and even about their own offsprings. From a medical standpoint, albinism is a genetic condition in which the body produces very little of a natural pigment called melanin, the substance responsible for the color of our skin, hair, and eyes. Individuals with albinism can live normal, productive lives with appropriate precautions like sun protection and eye care. The real concern is not the appearance, it is genetics. If the partner is not a carrier, children will not develop albinism or this condition. If the partner is a carrier, risk exists, and modern genetic testing can clarify this precisely. Many centers do the testing. Families facing similar concerns can follow three simple principles. The third principle or a factor is often ignored. First, understand the condition. What exactly is the diagnosis? Second, clarify genetic implications. Simple tests often remove unnecessary fear. Third, base decisions on the facts, not assumptions or the public gossip. Modern medicine frequently replaces anxiety with clarity. An essential reminder for all: genetic risk is highly individualized. Anyone with concerns about hereditary conditions or carrier status should consult a qualified specialist or a genetic expert. Genetic studies are available in many centers in India. General information is useful, but personalized evaluation is always important. Science reduces fear. Understanding supports wiser decisions. Always consult your specialist doctor, and both persons involved in the marriage, the girl and the boy, should have a scientific advice. Bye.